Hi, good afternoon, everybody. I'm a PGY3 internal medicine resident from Jacobi Medical Center, affiliated with Albert Einstein School of Medicine. So today I'm going to discuss about one of our research topic on the CAR T, the trends and disparity patterns of CAR T therapy utilization, inpatient mortality, and adverse events in U.S. Before I get started, I want to offer some backgrounds. So why this topic is important. So we all know that in the past few years, there are huge breakthrough for CAR T therapies. Since the FDA approved the CAR T therapy in 2017, especially Yescarta, Kymriah, and there are like more and more approval of the therapies, and the indication also expanded beyond leukemia, DLBCL to multiple myeloma and some solid tumors. And also the CAR T has also goes from third line, fourth lines to second line or even upfront therapies. So with this advancement, we know the update of CAR T therapy has been steadily increased. But there are few studies focused on how those uptake has been differs across different groups, social, demographic groups, specifically different, race, ethnicity groups, different hospital regions, and different indications, and also adverse effects, especially for CRIs and icons, which has increased the cost. So for us, we have three major goals for our research. So first, we want to know what's the overall trend of CAR T uptake patterns from 2017 to 2021 across different US regions. It's mostly using the inpatient data. And the second goal, we want to characterize the subgroup patterns, the disparity across different age groups, race, different hospital and regions. And last but not least, we also want to understand what's the trend and the patterns of the adverse outcomes for CRIs icons, also using the inpatient populations, and also to study about the cost and the length of stay. So to achieve these goals, we basically use the National Inpatient Database. This is it's probably one of the largest database. It's public available, all-payer inpatient database in United States. It contains data over 7 million hospital stays, which representing about like 35 discharges across the national. And it provides a national and regional estimates for the trends and the healthcare utilization charges, quality and outcomes. So we basically did this cross-sectional, like pulled cross-sectional study designs with longitudinal analysis of the trends from 2017 to 2021. So we defined the CAR T therapy using the ICD procedure codes and the indications, leukemia, lymphoma, multiple myeloma, and adverse outcomes also identified using the relevant ICD diagnosis code. So for the results, we actually have a lot of very interesting and exciting discoveries. So overall, we discovered the CAR T therapy utilization has increased significantly from to 70 cases in 2017 when FDA just approved with a lot of clinical trials probably, and then to steadily increase to 3,000 in 2021. And we also discovered the non-Hodgkin lymphoma is most common indications, representing like 50 to 70%. But we also found out multiple myeloma actually has also emerged increased as the second most common indications by 2021 after FDA approved in the past few years. We also discovered regarding the racial ethnicity, the white actually constitute the majority of CAR T therapy populations, which is like 50 to 70 percentage. The disparity pattern seems to be a little enlarged in the past few years, and followed by Hispanic populations. The next one we looked at is different age groups. So we found out the adult population from 18 to 64, it accounts for the majority of CAR T recipients, around 60%. However, we did find out for the elderly over 65, the uptake actually has been gradually increased, and it's nearly equaling the younger population by 2021. Well, which also may reflect the increased multiple myeloma population, but increased access to CAR T among the elderly populations. Similar trends for the insurance population, we found out the Medicare coverage also has been rising to like 25% to 38% in 2021, which probably reflecting increasing elderly population. Regarding the regional difference, initially in 2017, we found out there are very large proportion of Northeast areas, probably because most of the CAR T clinical trials, the large academic center concentrated around that area. But with time going by 2018, 19, 2020, and 2021, it's actually the regional distribution has been equalized across the four different regions. So similar, pattern has happened for, the hospital size with initially most concentrated CAR T concentrated on large hospitals, which has been steadily equally distributed. So last but not least, we also looked at the adverse outcomes of CAR T, including the cytokine release syndrome and ICANS. So we did discover the CRS incidence actually has increased significantly from 17% to 60% in 2021. For ICANS and tumor lysis syndrome, it has pretty steady. Initially, there is an upward trend pattern, but then it slowly declines. Overall, the interpretation and takeaway is we think the CAR T therapy utilization has been increased over the past few years, especially with the expanded indications. And but we also notice the disparity still persists with white population and higher income patients still predominating. And the treatment patterns still concentrated in predominantly large hospitals. And we also found out the inpatient mortality has been stable, but the CRS is possibly due to increased awareness and also ICD coding, change of ICD coding. So yeah, with that, I think for the future, we need to explore more about what's the factors driving these trends and to ensure the equal access of CAR T therapy in different populations. So that's a brief overview of the studies.